This fifth installment of the Eddie video series will discuss what hearing loss is and the risk factors and red flags for hearing loss. Hearing loss occurs when one of the parts of the auditory system is not working optimally. These different parts of the auditory system are the outer ear, middle ear, inner ear, eighth auditory nerve, and the central auditory system. Experiencing a hearing loss results in decreased sensitivity to sound and/or difficulty understanding speech. When a pediatric audiologist evaluates a child's hearing, they obtain an audiogram. An audiogram is pictured on the current slide. Along the y-axis is loudness, going from very soft sounds to very loud sounds. Along the x-axis is pitch, going from very low pitches to high pitches like a piano. The right ear is represented by the red circles, and the left ear is represented by the blue X's. On the audiogram, audiologists mark the child's threshold, which is how loud or soft sounds need to be in order for the child to hear it. Normal hearing for a child is 15 decibels. In other words, the child's threshold should be at or above this line to have normal hearing.
There are different types of hearing loss depending on which part of the auditory system is damaged. These three types are conductive, mixed, or sensorineural. An individual's hearing loss can also be explained with a degree of loss: mild, moderate, severe, and profound. Hearing loss can occur in both ears, known as bilateral hearing loss, or in just one ear, known as unilateral hearing loss.
Sensorineural hearing loss is when the organ of hearing, or the cochlea, is damaged. This kind of hearing loss is permanent and cannot be fixed medically. Conductive hearing loss is when something is impeding sound's ability to get to the organ of hearing, or the cochlea. There could be a problem with the outer or middle ear. Some types of conductive hearing loss can be treated medically or surgically. Mixed hearing loss is a combination of both conductive hearing loss and sensorineural hearing loss.
There are certain risk factors that put children at a higher risk of having or developing hearing loss. Those risk factors are listed on this slide.
Infants with a risk factor for hearing loss should have at least one diagnostic audiology assessment by 30 months of age. Infants with risk factors associated with late onset or progressive loss, for example CMV, are followed more frequently.
There is a list of red flags to watch for that could indicate a baby could have hearing loss. The following signs are common in babies with more severe hearing loss. If a baby has a mild to moderate hearing loss, signs may be more subtle and more difficult to identify. Some red flags are listed on this slide.
Toddlers and school-age children will exhibit different red flags to watch for that could indicate hearing loss, which are listed.
There are milestones that a baby should reach for communicating and playing. If milestones are delayed, it could be an indicator of a hearing loss. Each child has different signs and symptoms for a hearing loss. Even if a baby or child passes a hearing screening, it is important to watch for the red flags of a hearing loss.